So far, we're talked about how to define the prediction target. Next, we introduce the cohort construction step. Cohort construction is about defining the study population. For a given prediction target, there are only a subset of patients that are relevant among the whole patient population, and they are the study population. Be aware, often we may not be possible to obtain data from everybody in the study population. As a result, the data set we studied is only a subset of those study population. So, the question is, how do we define the study population? There are two different axes to be considered. One, the vertical axis, we have prospective study versus retrospective study. On the horizontal axis, we have cohort study versus case-control study. Depending on the combinations, we have four different options: prospective cohort study, prospective case-control study, retrospective cohort study, and retrospective case-control study. In a prospective study, we first identify the cohort of patients, then decide what information to collect and how to collect them. Then start the data collection. In contrast, in a retrospective study, we first identify the patient cohort from existing data. For example, past electronic health records of patients, then retrieve all the data about the cohort. In prospective study, we identify the cohort and collect the data from scratch. But in the retrospective study, the data set already exists. We just need to identify the right subset and retrieve them. Next, let's talk about cohort study. In a cohort study, the goal is to select a group of patients who are exposed to a particular risk. For example, if we want to be in a predictive model for predicting heart failure readmission. Here, heart failure readmission means heart failure patient after discharged from the hospital comes back again to the hospital due to heart failure. In this case, the cohort should contain all the heart failure patients who discharged from the hospital, because they can potentially be readmitted after discharge. The key in cohort study is to define the right inclusion and exclusion criteria to figure out what patient to include. Here's a visual illustration. We start with all patients, then we try to identify the relevant patient for a particular risk. For example, these 3 patients are relevant for this risk, such as heart failure readmission. Then we want to build a model to predict the target risk. In this case, the cohort contains both positive and negative examples. For example, patient with heart failure readmission and patient without heart failure readmission. All this relevant patient is a cohort in this study. The other common study design is case-control study. In this design, we try to identify 2 sets of patient, namely cases and controls. And we put them together to construct the cohort. Cases are patients with positive outcome. For example, the patient who developed the disease. Controls are the patients with negative outcomes. That is, they're healthy patients but otherwise similar to the cases. For example, they can have the same age, gender, and visit the same clinics. The key here is to develop the matching criteria between cases and controls. For example, we want you to predict a model of heart failure. Then we identify a study population of over 50,000 patients, and we have 4,644 case patients. Those are the patients who developed heart failure. And we match them against a set of control patients on age, gender, and clinics. And we end up with 45,000 control patients. Notice that in this study, we have a lot fewer cases with heart failures than the controls without heart failures. This is pretty typical because in a real-world scenario, patients with the specific disease conditions are often harder to obtain, while there are a lot more patients without that disease are available to serve as a control. To summarize, in a case-control study, we first identify the cases, then try to match them to a set of control patients. In a cohort study, we'll identify all the patients who are exposed to the risk, and the matching criteria are not involved.